Hi, everyone. Welcome to our presentation, COVID-19 and Health Literacy, a Pandemic Toolkit. My name is Erica Dunnan, and I am co-founder of One Health Literacy Organization. I hold a Master of Public Health and a Master of Education. I'm also a Certified Health Education Specialist.
And my name is Askia Dunnan, co-founder of One Health Literacy Organization. I am a medical doctor and I have training in public health and molecular biology. I study the environmental and social determinants of health.
This disclaimer is to let you know that we are not providing medical advice. We are, however, providing educational content for you to further expand your knowledge. So what you will learn what we know about COVID-19, what happens during a viral infection, challenges and emerging issues, COVID-19 testing, COVID-19 vaccines, and health literacy. So what we know about COVID-19. We know that the virus spread to the United States in early 2020. Google search on March 6, 2021 stated that there have been 2.58 million deaths worldwide. There have also been 11,520 deaths in North Carolina as of March 6, 2021. So the virus is spread from person to person less than 6 feet apart, and people who are infected but have no symptoms can also spread the virus to others. Also, according to the CDC, it spreads less commonly through contact with contaminated surfaces, and it rarely spreads between people and animals.
So what are viral infections? We typically think about an infection when we have symptoms, but before those symptoms occur, specifically for COVID-19, this virus enters through the mouth and nose and multiplies millions of times over. Clinically, your symptoms are the result of many replicated viruses causing inflammation in your airways, but also in your blood vessels, anywhere inside of your body, essentially. So we commonly think of the common cold or the flu when we have symptoms such as a sneeze or a cough, chills, muscle aches, or fever. However, COVID-19 doesn't necessarily cause all or any of these symptoms because it hides from our immune system. And that is a specific danger when we think about asymptomatic transmission, which we will discuss later. So looking at this diagram, there's 5 steps that we want to think about. And so step 1, the virus attaches to a cell. Step 2, it becomes engulfed within a cell through the cell membrane. And in step 3, the virus rapidly releases its viral particles. And what we're calling a passive hijacking, the virus passively hijacks your body's cellular machinery. And in step 4, the body now starts to manufacture these proteins in abundance. Finally, in step 5, the virus is released into your bloodstream where it does this process over and over. So what makes COVID-19 different from other viruses? Well, there are common viruses, and so common viruses repeatedly spread throughout the world, and typically in seasons. So our season in the United States occurs between late summer and early spring of every year. And so common viruses include rhinovirus, RSV, and influenza. And those are causing symptoms that we typically think about with the common cold, such as the runny nose, the sneezing, muscle aches, fevers. However, COVID-19, like the other uncommon viruses in this slide, they don't have these same patterns necessarily. And in particular, COVID-19, this one was the first time it was introduced into the human population. And so because this was the first time in 2020 that the virus entered the human population, we struggle to understand what that really means. And our bodies struggle on how to deal with the virus. COVID-19 has high infectivity rates compared to other common viruses. And so what that means is that it takes just very few viruses, very few viral particles for you to become infected. Once you are infected, you don't necessarily have symptoms. So that is, again, the danger of asymptomatic transmission. You may be infected, feel fine, but pass on this infection to other people. Public health experts are constantly monitoring for COVID-19. And one of the things that they monitor for is transmission. Another thing they monitor for is changes to the virus itself. And one of one of the biggest fears is that the virus might change. And so this has in fact occurred with COVID-19. There's two types of changes we think about: antigenic shift and drift, which are big words that mean that the virus mutates dramatically from its original method of transmission. So there's three mutations that we are currently aware of. There is the B117, B1351, and P1, which are just variants that have been identified in these three locations in the United Kingdom, South Africa, and Brazil. What we currently know is that our current vaccines, Pfizer, Moderna, and Johnson & Johnson, provide some degree of immune protection against these variants. So we continue to track the status of these virus lineages as they do pose threats to our health and recovery.
So what is a vaccine? So we can think of a vaccine as something used to give our immune system a boost to recognize and fight the virus. And shown here, we have Vice President Kamala Harris getting her vaccination. Clinical trials are where scientists test vaccines on people. The trials operate in phases including 1, 2, and 3. Phase 1 involves a small sample of the population which volunteer for the study. Phase 2 involves a slightly larger sample of the population. And Phase 3 is the largest sample of the population and the final phase before it reaches us, the public. Operation Warp Speed is a government-coordinated effort that involves scientists trying to find a vaccine that will boost immunity and not cause harm to the body at the same time. Operation Warp Speed has never been done before. So in addition to where vaccines are given, really quickly, these same places are where you can also get tested for the COVID-19 infection. So the vaccines are given from public health departments, primary care offices, retail pharmacies, employers, and universities. You can visit www.vaccines.gov for more information on where to get vaccinated. Also, these vaccines on this particular slide are approved for emergency use authorization and are currently available. Pfizer and Moderna use mRNA, which involves 2 doses, and then the Johnson & Johnson vaccine uses DNA, which involves 1 dose.
So let's briefly talk about misinformation. Misinformation is defined as false or inaccurate information that is especially deliberately intended to deceive. The calling card for misinformation includes information that's indisputable or is presented as such, often coupled with humor, sarcasm, skepticism, or authority. Yet, this information doesn't have clear logic or validity needed to verify them. Misinformation relies on belief more than logic. One of the most discussed issues surrounding misinformation has been the claim that hydroxychloroquine cures COVID-19, and there's associated conspiracy surrounding withholding this drug. However, while initial anecdotal reports suggested that there might have been benefit, there was some deterioration in public trust because conflicting studies came out, which were the result of having inadequate power. And what this means is that the initial studies were poorly designed to answer the question. So finally, a meta-analysis was conducted. This type of study pools data from all the previous studies and leverages the power or the larger sample size to increase the power of the study and to get a more definitive answer. The conclusion was that hydroxychloroquine is more harmful than standard supportive measures for patients at various stages of their illness. Here are some popular social media sites which have notoriously spread misinformation. Here we look at how skepticism and authority might be used to persuade people not to become vaccinated. Again, using humor or sarcasm can disarm people who are well-meaning. And finally, using historically falsified information can perpetuate distrust and cause more harm than good to individuals. We recommend that you be on the lookout for misinformation and always refer to credible sources such as the CDC or the WHO at these respective websites.
Health literacy is defined as the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. Personal health literacy refers to individuals. Organizational health literacy refers to organizations. So again, personal health literacy has to do with your ability to navigate the healthcare system. An example of organizational health literacy is a hospital system's ability to meet your health literacy needs. This could be based upon how a particular service is provided to you, or even material that is suitable for your needs being given to you.
So as our understanding of the factors that influence health have evolved, so has the definition of health literacy. Whereas the previous definition introduced the concepts of your individual capacity to understand printed materials, such as materials given to you by your doctor or pharmacist. The new definition places more emphasis on how individuals use rather than just understand health information. Secondly, the emphasis is now placed on making more well-informed decisions rather than appropriate ones. Furthermore, as the role of corporate social contracts have expanded, organizations, not just hospitals, must take inventory of their own capacity to address health in the workplace.
So we want to thank you for viewing this presentation. Our mission is to provide health education services to North Carolina residents to improve health outcomes. Our services promote community health literacy, enabling people to contribute to their well-being. We ask that you visit our site, www.onehealthliteracy.org, and communicate with us to learn more about what we have to offer you.